Well, umbilical cord stem cells have been transplanted since 1988 now, so the potential is already realised in some ways. So we have the routine transplantation for blood disorders. But in addition to that, in the future, we have the ideas around regenerative medicine, and cord blood stem cells have a massive potential there because we can potentially make other tissue types, and those other tissue types can be used to transplant into patients. For example, patients suffering from diabetes, blood disorders, bone marrow disorders, heart disorders, and so on. So the potential of the stem cells is enormous, but it's important to say that the current use is also very important because there have been over 20,000 transplants now worldwide, and these are for hematological disorders, so leukemias and blood disorders, and the success rate for those is very good. So we're in the situation where we've got a very well-established system for the transplantation of cord blood stem cells for blood disorders, and also a massive potential for the future where we're going to be looking at regenerative medicine procedures. So the future is very bright. I think the stem cells found in the cord tissue are actually very exciting stem cells. They're called mesenchymal stem cells, and they can make various body tissues. They can make bone, muscle, connective tissue, and so we have a potential source in the cord tissue itself for the repair of a range of tissue in the body. For example, if someone damages their tendon, potentially we could use cord tissue cells to actually repair that tendon. And so this is the new concept of regenerative medicine, which is coming through the practice of clinical medicine now. And it's a very exciting and very interesting time that we're in, where we can use these stem cells to treat a range of diseases. So the principle behind regenerative medicine is to take stem cells and to use them to repair different tissues in the body. Family cord blood banks are extremely useful. The point about a family bank is that the cord blood is collected and it's processed and stored, and it's used or potentially used for transplant within the family. Now, most of the transplants that I've been involved with from family banks have been to siblings or to parents, and very occasionally to grandparents. Now, that's achievable because of the flexibility of cord blood. We can transplant with up to a 50% mismatch, and that makes it very flexible to use. So if a family has a cord blood unit stored, the chances of it being useful for a family member is very high. And that's why family banking is important, I believe, because it provides a resource of stem cells for the family to use as and when they need them. And the important thing is that they are there immediately that they're needed. I've seen a lot of patients over the years who unfortunately have waited for stem cell transplants and have not been able to get them. But if you have your cord blood stem cells in a family bank and the need arises with the family, they are ready immediately and there's no delay and the patient can be treated. So I think cord blood banking for the family is an important and clinically effective process.